Cases and concerns continue to rise after the state reported another high number of COVID-19 cases today. Hospitals are steadily filling up, and it's leaving health officials concerned about the number of patients they can house. Our Stephanie Poole joins us in the studio to explain.
That's right, Joey. State Health Officer Dr. Thomas Dobbs says COVID-19 is getting worse throughout the state, and that increase in cases has 5 of the largest hospitals in Mississippi full.
We've had a steady increase in coronavirus cases, deaths, hospitalizations over the past several weeks, which is not a surprise. We've been talking about this, saying it's coming, and here it is.
On Tuesday, 703 new COVID cases were reported in the state. Dr. Thomas Dobbs says the ability to provide patient care is creating more questions than answers.
When I talk to my ER colleagues, I'm understanding they can't get them anywhere because there's nowhere to send them. We're sending people out of state all the time because Mississippi hospitals cannot take care of Mississippi patients.
OCH Regional Medical Center has 3 COVID-19 patients, with 1 in ICU. 3 beds are available with others on reserve. Baptist Golden Triangle has 12 patients in ICU. They have the capacity to add additional beds if needed. In a statement from North Mississippi Medical Center, Chief Medical Officer Dr. Jeremy Blanchard says there are ICU beds available at the Tupelo Hospital and within their system to care for COVID and non-COVID patients.
I am also convinced that what we're doing now is not working. It is not safe, it is not smart, and it is not effective. We went from shelter in place to really wide open.
UMMC Chancellor Lou Ann Woodward and Governor Tate Reeves are urging citizens to wear a mask.
What we have got to find is the right place in that middle ground. We have got to find a way to live. We've got to find the right way to live with this virus for the foreseeable future.
What we're trying to ask Mississippians to do is to recognize the risk that we as a state currently face, and we're asking our local law enforcement teams and officers to help people adhere to these rules and guidelines and just use common sense.
And it's going to take several medical facilities to keep control on the outbreak. Dr. Dobbs says rural hospitals will be used for any overflow.
Now is the time for the hospitals to have to step up and try to counter the impacts of reckless social behavior.
Itawamba Community College has an agreement with the MSDH to serve as an official site in North Mississippi to be used as an alternative care site. Any facility that will be used will be completely isolated during use and sanitized post-activation. Now, there are also plans for opening Camp Shelby if hospitals in the state become overwhelmed.